Every so often in medicine, something comes along that changes everything, and we are living through one of those moments right now. For as long as we can remember, the fight against cancer has been, well, it's been brutal. But that's all starting to change. We're stepping into a totally new era, leaving behind the old ways we thought were the only way.
So let's just get right to it. I want you to think about this question. Can cancer just disappear? Without chemo, without radiation, without surgery? I mean, it sounds like something straight out of a movie, right? More like science fiction than actual science.
Well, what if I told you it's not science fiction anymore? For some patients, the answer to that question is a definite, proven yes. And listen, this isn't just some headline-grabbing claim. This is a new reality backed up by hard data published in the absolute top-tier medical journals. We're talking the New England Journal of Medicine.
Okay, so this is a revolutionary promise. Let's dig into what's actually happening here. What does this future really mean for someone diagnosed with cancer?
And this is where the thinking completely shifts. It's not just about surviving anymore. It's not about just adding a few more months or years to a life that's been hammered by treatment. The new goal? It's a cure. A real cure that lets people go back to their lives, back to their jobs, back to their families, like it never happened.
Now, to really get how big a deal this is, you have to understand what we're moving away from. We have to talk about the scorched earth past of cancer treatment. This is the reality we're trying to leave in the rearview mirror.
Yeah, for so long, the main strategy has been what doctors themselves call a scorched earth approach. Think about it. To get the bad guys, the cancer cells, you basically have to destroy everything around them. Your healthy cells get caught in the crossfire, and the damage to a person's body, it's just enormous.
And you can see the difference right here. Look at the old way. Surgery, which could mean losing a part of your body. Radiation, chemo, hair loss, feeling sick all the time. A real risk of having to quit your job. Now look at the new way, using your own immunity. We're talking about preserving organs, keeping your quality of life, and being able to keep working. The difference is just night and day.
And this isn't just about physical suffering. The economic cost is huge. Take Japan, for example. The estimated loss to the economy every year from people having to leave their jobs because of cancer is about 1.2 trillion yen. That's almost 8 billion US dollars every single year. That's a massive hit to society.
So how in the world does this work? What's the secret sauce? Well, it's not some new kind of chemical or radiation. The secret is already inside of us. It's about finally figuring out how to unleash the immune system.
The hero of this story, if you will, is a specific immunotherapy drug called dostarlimab. Now here's the catch. It works like magic, but only for cancers that have a very specific genetic fingerprint. It's called mismatch repair deficiency, or DMMR for short. You can think of it like a typo in the cancer's genetic code. That typo makes the cancer cell look really weird and stand out, but only if the immune system's alarm is switched on.
Okay, here's a great way to picture how this works. Imagine the cancer cells are really smart. They've figured out how to wear an invisible cloak. This cloak basically tells your immune system's security guards, hey, move along, I belong here. It's like putting a brake on your body's entire defense force. So what does dostarlimab do? It comes in and rips that cloak right off. It releases the brake. And suddenly your immune system goes, whoa, wait a minute. And it can finally see the cancer and go on the attack. All right, that's the theory. But the big question is, does it actually work? Well, a huge study with the latest data from 2024 published in the New England Journal of Medicine gave us the answer. And the results are just mind-blowing. In a group of rectal cancer patients who all had that DMMR gene, over 82% had what's called a clinical complete response. So what on earth is a clinical complete response? It's medical speak for something amazing. It means that after the treatment, doctors couldn't find the cancer anymore. Not on any scan, not with any scope, not with any test. It was gone. For these people, that's the difference between having life-changing surgery and not. It's incredible.
Okay, so this isn't just a story about science. This is about life beyond the diagnosis. The ripple effects of this go way outside the hospital walls. We're talking about our jobs, the economy, and just how we think about a cancer diagnosis in the first place. Just try to imagine this. A new reality for patients. A cancer treatment where you don't lose your hair, where you're not constantly sick, where you can actually keep your job, where you can avoid surgery that would change your body forever. You just get treated and get back to your life. We're really moving from a world of just surviving to a world where you can actually thrive. Now, I know what you might be thinking. These new drugs must be incredibly expensive. And you're right, they are. But that's only looking at one piece of the puzzle. When you add up all the other costs, the surgery, the long hospital stays, the lost wages for patients and the family members who have to care for them, this new way could actually end up being way cheaper for everyone in the long run.
And I think this quote just says it all. Cancer treatment is shifting from a battle to simple management. Think about that. We've always used the language of war, fighting cancer, battling tumors. This changes that. It becomes a condition you manage, not a war you have to win or lose.
Okay, so as exciting as all this is, we have to be real for a second. With any massive breakthrough, there are always challenges. So let's talk about the road ahead.
And this is probably the most important thing to know right now. This isn't a silver bullet for all cancers. Not yet, anyway. It only works for patients with that specific dMMR genetic marker. That's only about 5 to 10% of all cancer patients. So for the vast majority, the other 90+%, this isn't an option today.
So the work is far from over. There's a clear to-do list for researchers. Number one, we've got to get better and faster at genetic testing so we can find every last person this can help. Number two, unleashing the immune system can have side effects, and we need to get better at managing those. And then there's the big one, the ultimate prize, figuring out how to get this to work for everybody else.
But let's pull back for a second and look at the big picture. 100 and something years ago, getting a bacterial infection could easily be a death sentence. And then we discovered antibiotics, and it changed the world. This quote here suggests we might be at that exact same kind of moment for cancer. We're standing on the doorstep of a future where it's not this terrifying killer, but just a manageable condition.
And the craziest part is, this isn't a pipe dream for the distant future. It's happening right now. For some people, the future is already here. The shift has begun. So I'll leave you with this to think about. After hearing all this, what do you think the future of treatment without cutting holds? What does that world, where surgery isn't the default answer anymore, actually look like to you?